Good afternoon, and welcome to TKAAM Thursdays, your midday cultural break. I'm Dr. Lana Reeves, and we're coming to you live from the Kansas African American Museum. And today we have as our special guest to help us to celebrate not only Black history, but women's history, and really right here locally, Wichita history, which is also a part of Kansas history. So we got it all covered, right? But we're sitting here today with the Wichita Black Nurses Association, who has a very long history right here in Wichita, Kansas. And first, we're going to start off with some introductions, and we'll start off with Mrs. Roundtree over there. Would you like to introduce yourself and tell us a little bit about who you are?
My name is Edith Roundtree, and I am a charter member of the Wichita Black Nurses Association. And Lord willing, we'll have our 50th year next year. We were starting in 1973. And there has never not been a Wichita Black Nurses. We have been there all the time, never went away. Sometimes there was 2 or 3 of us, but we were there.
All right.
And we have participated in hundreds of health fairs, I didn't count them, and thousands of health projects, all over the years, yeah.
Okay.
I'm Theola Cooper. I'm also a charter member, and I became interested in nursing at 15. In fact, I lied and said I was 18 and started working at the hospital.
All right.
That's a whole different ball game, but I've enjoyed it. It's been an enrichment in my life.
Hello, my name is Midge Dempsey, and I have been a member of the Wichita Black Nurses for about 15 years.
Mhm.
And my mother was a nurse, and so that's who inspired me to become a nurse. She would come home, and before she would go to work, she would make sure her uniform was pressed. And back in her day of being a nurse, she had to have her hair pulled up, and she had on that white nurse's cap. And she just had so much honor in serving people and being a nurse, and that's why I chose nursing.
Awesome. That's a pretty good reason.
Yes.
Mama did it.
Mama did it.
Okay, so I understand today that Mrs. Roundtree, you're going to tell us a little bit more about your history. Why did Wichita Black Nurses Association begin back in 1973? What was your purpose for being?
Well, we had 2 nurses here at the time, Frankie Manning and Grace Dunlap, who had the first national Black nurses was started by Dr. Rand Sands. And she was out of which university?
Tuskegee.
Tuskegee. All
And
right.
when they came back, they were all enthused about it because at that time there were no Black nurses, head nurses, no faces on the front.
hmm
And that was kind of our purpose, but then we got off into caring for our people because care was not, they didn't have good access to health care at all. And people was in the emergency room all day and night. We had the old county hospital, and that's where Black people went for health care. So we got off into that and started doing hands-on nursing. That's how we started. We had originally planned to make things better in hospitals for Black nurses, and then we got into nursing.
All right. So it became twofold. First, it was about making sure that Black nurses had a way to go,
Yeah,
and then it became about taking care of Black
our
people.
people.
And you say that in the early days, back in 1973, it was the county hospital where most Black people went.
Yeah, and before that,
Okay.
they had it. They sat in the emergency room over there, all day, all night. Sometimes well, I know a couple people died over there in the emergency room. Yeah.
And so in those early days, did you have to go into the emergency room and start nursing, or were you able to help get them beyond the nursing room? How did that work?
No, when you started, we started in the community nursing. That's what
Okay.
we mostly did at the time. Yeah.
Okay. So, what were some of the early projects that you worked on in the community?
We gave baths to a lady weighed 300 pounds. She didn't have anybody to bathe her, and
Mm-hmm.
she almost pulled all of us in the tub with her. But we gave baths hands on. We gave insulin to people. We did all of the things that there was nobody able, to do for them. We went all over the community.
Okay, so
And
basically, it was like back in those days, that would be about the time when doctors really stopped doing house calls, and the Black Nurses Association,
and we
Wichita
didn't
Black Nurses,
have
did the house
any
calls.
doctors. I think we had 2 or 3 black
2 or 3
doctors.
black
Yeah.
doctors. Okay.
And people, they just, healthcare just was not good.
Mm-hmm.
And so after you get out in the community, then you see how really bad it is. And we did well baby clinics,
Mm-hmm.
you know, check people's baby when they were born, and done all that volunteering without any pay.
So you probably helped go a long ways towards improving the infant mortality rate here in
Yes, I
Wichita
think
too,
I think
right?
we did. Yeah.
Because that's always been an issue with what low birth rates and
And a
the
lot of
low.
babies dying.
Hmm.
Yeah.
Okay. So do you remember some of the activities that you participated in, Mrs. Cooper?
Well, I want to piggyback on the lady at Calvary Towers.
Mm-hmm.
That's where we first started. We would check. We went room floor to floor, checking their medications,
Mm-hmm.
giving baths, and sometimes we would cook for some of the people. The other thing was we would do a blood pressure check. We found we would do referrals because some people, even though they had a doctor, they were treated for hypertension. He was not checking the blood pressures.
Oh my
So I
goodness.
had to do a reach out
Mm-hmm.
to another nurse where she worked and said, "Can we get this patient over to your doctor's office so she can be treated for high blood pressure?"
Mm-hmm.
And that's one of the things. And I worked community health, so that was just right up my alley. I was just so elated with everything we were doing because I was also working in model cities at that time. So
Okay.
it just helped to support what I was doing and making sure that we had all these community
Okay.
resources for the Black nurses as well.
So when you did community health activities, is that something that you partnered with other agencies and churches in the community or through the doctor's offices? How did that work?
Yes, and we did classes, and I reached out. We had nutrition classes,
Mm-hmm.
uh, prenatal classes, and just many other exercise. We had many activities in model cities that I could refer back and forth to the
Now,
Black nurses.
explain what was Model Cities.
It's a federal program,
Mm-hmm.
and we were divided into different stations into throughout Wichita.
Okay.
And the one station we had was at 17th and Pennsylvania, local housing. We had another one that was at 21st and Minnesota. And so and then like in the Hispanic area, like where Evergreen,
Mm-hmm.
down south, where like Linwood. So we were trying to also promote getting a health clinic.
Mm-hmm.
Once that closed, we knew it was going to be for 5 years. So that's another story. We didn't get a health clinic in our area until Center for Health and Wellness. But it was always our goal
Mm-hmm.
to get
Okay.
one that was significant.
And which one was the first one, did you say? The first one that you were able to get, the health clinic?
The one that for our community
Uh-huh.
was not until Arnitha Martin
Arnita.
was Center for Health and Wellness, which is now Health Corps Clinic.
All
But that's a long time coming.
right. A long time coming. Yes, indeed. Because it's kind of new there, isn't it?
Yes,
Okay.
1998.
98. Okay. Awesome. Now, what was it that brought you into nursing? You said you were doing community health. What?
What as I mentioned, I lived, well, at 15, I guess I worked at St. Francis. It's just something for the summer, you know. I said, "Oh, I'm 18." I was 15, but just for money, and I worked at night, and so I got exposed to nursing at that time.
Mhm.
Although went ahead and did other things, uh, became a bookkeeper, and that then I went back to nursing.
Okay.
But it's just something I always wanted to do,
Now, do
and
you
I
remember what it was though that at 15 that made you want to say that you were
well, it might
18?
have been. I think maybe other people just worked at the hospital, and
Hmm.
it just sounded
Thought it was a cool
interesting to
place
me.
to work, huh?
Yeah,
Okay.
and that was a day. Well, we have to do another thing about segregation, blacks
Hmm.
and whites at the hospitals. But yeah, it was just a fun thing I enjoyed doing.
Okay.
Hmm.
Awesome.
Those nurses in those pretty white uniforms, like she's, and the caps on their head,
Hmm.
and you just wanted to do it.
Is that what drew you in as well?
Yeah,
The uniform?
yeah, and I was
Hmm.
15
Hmm.
too, a nurse's aide at
Okay.
Yeah.
15.
Well, I worked at night, so they didn't do all that. We worked in the
Yeah.
nursery,
So you
but
were taking care of the babies
they
in the
taking care of the
evenings?
babies,
Okay.
and yeah, yeah. In fact, I have a little sister. She was born when I was 18.
Okay. When you really were 18. Okay.
So I took care of her in the nursery.
Okay. Awesome. And what about you, Mrs. Roundtree? Did you have a story like that? That you got to do something like Mrs. Cooper is able to take care of her sister when you were so young? Did you get an opportunity to help your family as well?
Yeah, and well, I was having babies at the time. I had seven. I was in and out of the hospital with babies,
Mm-hmm.
and a lot of the ladies around here that have a lot of children, we had babies at the same time, like Miss Dennis
Mm-hmm.
and Mrs. Childs, and all of us. We
Mm-hmm.
had 8 and 10 kids, and I'd go over and give them advice and things like that. Yeah,
So you need to get
because
paid
I
for
had
that, huh?
seven. I had seven myself. Yeah.
All right. You had 7 children?
Uh huh.
All right. Awesome. And it was your mother that caused you to be a nurse, Miss Dempsey.
Oh, yes. Yes. She
Amazing.
took so much pride in it.
Mm-hmm.
And she would come home and talk about her patients.
Mm-hmm.
And she was such a good caregiver at
Mhm.
home. And then I just thought,
You want to
that's
be
what I
like
want to
mom.
do.
Mhm.
Yeah.
Most
So
of us want to be like our moms, don't we?
we do.
Hmm.
We do.
Yeah.
And she was making a difference.
Indeed.
Mhm.
Just like you.
I
Yeah.
hope I am.
Yeah, you are.
Now you guys can guarantee that she is making a difference,
Yes,
right?
she
I
is.
can.
If she has any
Yes.
doubt.
Uh,
Now, you remember one of the first projects that you worked on in the early days back in 1973? Because
oh,
you are both charter members, right?
yes. Well, we did a lot of health fairs,
Mm-hmm.
and we different churches. Just all
All
the
of them, just
churches,
about.
and we went to the convention. That's what I just wanted to say. What inspired us so
Mm-hmm.
much. Edison and I went to St. Louis for a national convention,
Okay.
and we were in awe of all of these professors, all these women, and their heads of departments in the nursing, in the hospitals,
Mm-hmm.
And they were all black people.
and all black.
That's
And we
kind of
we didn't
amazing
even
when you
go
see a
out to
group like that, isn't it?
we didn't even go out. We just would look around and see all
Stayed
of
in
these
the hotel.
people,
Mm-hmm.
and then we would meet like doctors. They would give us. They had a Arthur there. I didn't bring his book, but about textbook of black health related diseases.
Okay.
Because Wichita, you know how we are. I mean, in some of those places, so many black patients. So that was a inspiration just to see people of prominence and all these professional people there at the convention. That inspired us to come back. One of our first projects was take showing how to take care of a black patient, like their hair and their
Mm-hmm.
skin and that type of thing as well.
Now,
That
did
was
it kind of amaze you that other people didn't realize that they needed to know something like that?
right.
Yeah,
Yeah.
when they go into nursing homes, sometimes they got their hair cut off because the people in there didn't know
Didn't know
how to
what to
care
do.
for it. So when it got, kind of kinky, they just get the scissors and cut
Mhm.
it off.
Oh my So, so now looking back over the 49-year history and over your last 15 years of being involved in nursing, what are some of the things that you see that are different today than then? And maybe what are some of the things that you still haven't changed, but what you would like to see change?
Well, health disparities haven't changed. We still
Mm-hmm.
have more cancer, more heart disease, more everything. Black people, it has changed in some respect as far as getting treatment, but we're still more of it, with us.
Mm-hmm.
And also the infant mortality thing. Babies are still dying. I guess right now it's better, but
Mm-hmm.
it took a long time for all of that to change. Hypertension, because people just tell you, I'm going to eat what I want to eat, and they did. And so they listen now more. Yeah.
Okay. And what do you see different, Mrs.?
I see pretty much the same. I read the obits, I hate to say every day, and I'm just seeing younger people dying at a
Mm-hmm.
earlier age. I mean, they're
Mhm.
just dying. I think lack of health care
Mm-hmm.
that hasn't changed. Uh, I see this. The infant mortality rate is maybe slightly down, but it's
But it's
still
still
up
higher than
there.
it needs to
Still,
be.
we need to really improve on that. Hypertension, I think we just need more nutrition. Young, like the WIC program,
Mm-hmm.
to help the young mothers start early teaching their, so they'll know about not giving the kids all the junk food and how you can do healthy foods, and maybe that can be shared on up so we don't not bother with all that hypertension that we have. But I still see we need nutrition classes, diabetes classes, which
Mm-hmm.
very few of us go. When I go, it's me and maybe one other person.
Mm-hmm.
If we can convince them, like through what Midge has done and we do at our churches, and I see that as maybe something that's going to grow since we've been exposed. But we
So
just
now,
need
what
more
what do
health.
you do at your churches? What do you do?
We have, I've always had health fairs
Mm-hmm.
and different speakers to come in about resources in the community, something on nutrition, something on finance, to try to do the broad.
Mm-hmm.
And the last time we networked with the 5 churches, so it just wouldn't be one church. We all of them on our the blocks from 25th to 28th Street. There are
Okay.
5 different churches, so we did that before COVID.
Before COVID, right? And
And so I
COVID's
think
kind of
that's what I
twisted
see
things
us
up.
maybe
Mhm.
doing now that our name is out there. These us
Mm-hmm.
grouping together, coordinating, getting um, noted speakers
Mm-hmm.
on diabetes, on hypertension, strokes, Alzheimer's,
Mm-hmm.
and those types of things.
And so, and what about you, Mrs. Dempsey? What are some of the things that you've seen in the last 15 years that just make you go, I'm glad that changed, but this still has not changed?
Are we going to be here for about 2 or 3 hours so I can tell you everything?
Oh, okay.
I think you get
Well, first of all,
Yeah.
one thing that I've noticed, there are more African American nurses
That's a
in the
great thing, right?
hospitals. That's a great thing, because when I was attending nursing school, I was the only Black person in a graduating class of 15.
exactly
Wow.
right.
And
About right.
one thing about being a part of this organization is being able to gather with other Black nurses who can mentor you,
Mm-hmm.
because these ladies, they have mentored me. They understand me. They know what I'm going through as a Black nurse working on a unit where I'm the only Black person working in labor and delivery.
Mm.
So when I go to meetings and I go to these ladies and I can tell them what's going on, they can give me advice. So that has definitely changed. The support that I've received, and also just the nurses who
Mm-hmm.
are now Black people who are going into nursing. And another huge difference that I think our organization is making, and where I see the most impact, we are addressing many issues, not just diabetes, high blood pressure, but I work for a procurement agency where I go and approach African Americans, a variety of people for organ donation. African Americans, we have the lowest rate of signing up to be donors. But guess who's at the top of the list for kidneys?
Mhm.
We are. Not only that, African American organs function better in African American people. We can accept a kidney from a Caucasian person, from an Indian person, from an Asian person. But if you receive a kidney from an African American, because of our makeup, genetics, it will function better. So we are also approaching that. We are educating our African American community about organ donation. We are dispelling those myths that are out there about donation. Um, Another thing that we're doing, the infant mortality rate. We are collaborating and partnering with other agencies. In 2011, I was working at the Sedgwick County Health Department in a program called Healthy Babies. So I would go into homes and educate primarily teen mothers. So from my employment there, I brought it to our group. And I said, you guys, we have all of these young African American women who are having their babies early. They're needing community resources. So our organization, we put our heads together, and I mentioned having a safe sleep baby shower. So now we have a partnership with the Kids Network where we host twice a year a safe sleep baby shower. Anybody in the community can come. They will get a free crib. They will get a safety sleep blanket.
And a pack.
They will get, yes, they
Pack.
will get education. And we're helping to decrease the infant mortality rate.
Yes.
That is awesome. Now, if you say are you still having that 2 times a year, or has
We're-
COVID curtailed
COVID
that?
has really impacted it.
Mhm.
But what we are doing now is, since we're in a partnership with the Kids Network, they are having individual classes, and they are going into homes of some of these young ladies who need a safe sleep environment for their child. So we're still doing it, but it's on a much smaller scale because we're not able to meet in a group setting. But we're still out. We're still involved. Yes, we're
So
still
we
involved.
are also thanking God that that is about to come. This COVID stuff is about to come to an end, and we can move back into doing things the way we used to do. At least getting to
We
be
hope
able
so.
to be near people more,
Yes.
and
We
be able
hope.
to have classes with more than just 1 or 2 people. Right?
Yes, yes. And we're really, really involved with this whole COVID,
Right.
the vaccinations.
Yeah, you've done a lot to help get the
COVID.
Black community and people
Right.
of color in general,
Oh my.
nervous people, vaccinated.
Yes,
Just nervous people, period.
yes. We have vaccinated over 2,000 people here in Sedgwick County. At my church, St. James Missionary Baptist Church, we had the first COVID vaccine clinic on March the 7th. We vaccinated 161 people. People who came in the doors, we would ask, why did you decide to come and take the shot? And they said, because the Wichita Black nurses look like us, we could trust them, and we were all vaccinated. And not only that, a lot of people who entered said, I just live right down the street. I know this church.
Right.
Maggie Thompson has branched that out. She's another member, and she has contacted several churches here in the community. and put that out there. Hey, we would love to come and host a vaccine clinic at your church. And so she brings that back to the group. We have everything is really organized, bring it to the members, and we sign up to go help. And we show up in large numbers.
Yes, you do.
You have
Yeah.
nurses who are vaccinating, you have nurses who are observing, you have nurses who are working and just doing a little bit of everything and observation and educating. And not only do we administer vaccines, we're also talking to people about their mental health, because Black mental health is a really big thing.
And COVID has
So-
not helped that at all.
No.
Mm-mm.
So not
no.
only
Made
are
it
they being
worse.
vaccinated, they're getting, it's a one-stop shop, because we're taking care of the community's needs and we're referring them to food banks. And we're doing that. The Black nurses, we are doing that. And then we have such broad shoulders to stand on and to support us. That is so important. They can never die. Never, ever.
So what they started out, what it is now, 49 years ago, doing is taking care of each other and then taking care of the community. They're still doing it now. As you can see, Miss Dempsey's referring to. They brought some friends into the studio with us today, or into the museum, and it's not just the three of them here, but it's three more just backing them up as well that are also a part of the organization. We could probably pack this table out with a big round table with a class of just nurses who are a part of the Wichita Black Nurses Association, who are indeed making a difference here in the community, not just Wichita, but like she said, Sedgwick
We are
County.
fortunate that we represent all branches of nursing. We got orthopedic, mental health, baby nurses, OB, military.
Brand new nurses, because I've run
No,
some
just
that just graduated from nursing school that
So,
are
yeah,
joining the
yeah.
organization as well.
I would just like to say for many years, it was only maybe 7 or 8 of us way back in the day. And then I don't know who was responsible, Anise, Margaret Bell. Some of those brought others in, and it just helped so much
Yeah,
more.
it did.
And then I'm just so pleased to see it grow and grow with new faces and the old ones promoting health and bringing others in to our group. And I just hope it'll continue to grow. And I see us doing the mental health, like she mentioned, but there's some other, the Alzheimer's, which also affects us greatly. We need to, I see a big future for us to do a lot more in this community. Just it just
Since
really
I-
warms my heart.
Since
I'll
I'm
just say that.
having grandchildren, I see something that bothered me. My daughter's daughter, they let her walk around with a 90 bottom number on her blood pressure. They told her it's okay. It's not okay.
No, it is not.
And she she called my daughter and said, "Well, I took it, and I got a 90 on the bottom."
Oh.
Well, the doctor, and they just happy that she's walking around like that.
Without any kind of care.
And it just aggravates me. I mean, and a lot of them out there are doing that because the doctor tell them it's okay.
What we need to educate our own and be advocates. Because
Okay,
I
so-
go to the doctor. That's the other thing. I go with some of the older people and I
Yes.
take notes. I go
Yes.
in there with them, write their blood pressure and everything
Yes.
down. And that makes them be more responsive to that patient.
Especially
And-
when they know she brought a nurse with her.
And
They're
then we
going to
can
listen.
Yeah.
and then we can follow up as well with that person.
Because nurses
Yes.
are notorious for making sure that doctors keep on their toes. Right?
Yes, we are.
And that's a good thing.
Yes, I take blood pressures at my church. And before COVID, I was taking blood pressures twice a month.
She was.
And so, of course, these ladies were doing it in their churches. So that's how I learned. And so I said, I'm going to do it at my church. And so I'm not saying just me, but we have actually helped so many people in our churches. People just from me doing the screenings at church, we have caught so many members who have high blood pressure and have referred them to the community clinics if they don't have insurance.
Right.
And as an advocate, I will go to a doctor's appointment with a member, with a church member.
Yes,
And
like you said, that make sure that the doctor is more pays closer attention and is more responsive.
yes, and they are. They are. If you support someone else and you show up there at that appointment
Mhm.
and you write down everything that you want to tell that doctor and you have some credibility, I've seen it happen. They will say, "Oh, well, yes, well, we won't see you in 6 months. Maybe you should come back in 2 weeks."
Well, all right. That's
And teaching our congregation, keep track of your blood pressure. If you have diabetes, reach out to those community resources. There are free things in the community to help you with your diseases that you have,
mhm.
but people don't know where to go. That's where we come in. That's where we come in. And a lot of it starts in the church. A lot of it starts in the church.
And that's a great conduit into the
Yeah.
community. That
Yeah.
it's much
Yes.
easier for people to come to church than it is sometimes to get to a clinic. One,
Yes.
because they're not always available,
Yeah.
and two, because they're not always close.
That's right.
If they are available.
Yes. I wish I could develop some type of program where I could go into the clubs. But my husband won't let me. But that would be an ideal spot.
That would
Go
be
to the
next
clubs
spot.
and the liquor stores and the
Mhm.
beauty salons
And the barbershop.
and the
And
barbershops.
the
Yeah.
barbershop.
I bet
I've been thinking
the,
about that.
the black nurses, we would be there.
Yeah.
We would be there and
Been
we'd be
thinking.
ready to educate and do whatever we had to do.
Hmm. So now you have a platform today. If there was one thing that you could, and maybe even two things that you could tell people that they need to know that they maybe don't know or realize that they should know, would you like to give one of those tips today?
Eating is one of the main. I mean, it really on how
Nutrition,
you
huh?
start your children out to eating
Mhm.
right, and of course my grandkids don't eat right, so but it plays a big part in how your health is when you're older.
Okay. So,
Salt and fat and
mhm.
sugar and all the stuff we eat. You know, yeah.
So can you name a couple of healthy, fun snacks that kids could eat, anybody could eat, that would be healthy
Well, my
yet
grandkids like fruit and carrots.
okay?
They like those little
Mhm.
old carrots and fruit.
Mhm.
That most children like
And if
fruit.
you start them out young,
Yeah,
they like it better than if you wait till they're eight
yeah.
years old. And
And don't buy that stuff.
Mhm.
Just
Right.
don't buy it.
Right. Okay.
Yeah.
I would say physical activity.
Hmm. And what would you
Keep
recommend for physical activity?
whatever you can do. If you can walk
Hmm.
or ride your bike or go to the gym. But
Hmm.
I like to garden and try to do it every day or twice a day and share it with your neighbors or whoever. And then that also helps you to eat healthy because you're going to get rid of those tomatoes and those cucumbers.
That's right.
You're going to eat it for breakfast too. But you don't have to utilize all of those things.
You
So,
haven't figured out how to grow lollipops yet, huh?
yeah, no. That's what I like. It was good. It's good for your mental health as
Right.
well as your
Hmm.
physical health,
And they get you out in the sunshine as well, right?
and you have to get up a little early.
Hmm.
You have to follow the sun. You have to get there.
Yeah.
On the east.
Hmm.
You gotta get there early and then go to the west before the sun. Yeah, so it's really great. I like that. And
Most children like gardening if you do it. They
and,
like
and
it.
I guess that's the other thing I would like to promote is container gardening for kids. If they see something growing,
Mm.
Hmm.
have them a little tomato plant or a little pepper plant, and then that introduces them into part of that food desert too. Because eventually you're gonna try to do more.
Hmm.
Yeah.
Okay, Miss Dempsey.
Please establish a medical home. And when I say medical home, you need to find a physician that you trust,
Hmm.
and that's who you go to when you're sick. So many of us go to the emergency room. Those physicians don't know us.
Hmm.
They will patch you up and send you on your way. We never follow up because we don't have a medical home. If you have a medical home, which means you have a physician that you go to and your family goes to when they're sick, make sure that you go for those regular screenings. In those regular screenings, when you are of the appropriate age, you will have your physician tell you, have you had your mammogram? Have you had your pap smear? You're not going to get that if you keep going to the emergency room. Not having insurance is not an excuse. We have community clinics. They will work with you. But once you get established in a medical home with a physician, they will have your records of everything. They will know, oh, I know you. If you have to go to the emergency room and they ask you, who is your doctor? Oh, my doctor is so and so. Right there, that's credibility. Oh, so you have a physician. Oh, so we're going to send these lab results to your physician and let them know that you were in the emergency room today. Same thing with the dentist. Oral health is so important. Adequate oral health can prevent you from having a lot of cardiac problems. Going to the dentist, having your regular cleanings and exams, we can ward off a lot of illnesses just by having those preventive measures taken. Stop utilizing the emergency room for every little thing. That's what's driving up the insurance costs. A lot of times you don't need to go to the emergency room. You just need to make an appointment with your physician. So I would say establish a medical home for you and your family. And then you can call one of us to go to the appointment with you.
That's right. So we have some really good advice today. One, good nutrition. Two, physical activity. And three, a medical home must be established, not just for you, but for your family. If we do those three things, we'll go a long way towards having a much improved healthy outlook. And also a fourth thing to remember is Wichita Black Nurses Association is a great place to go to know and learn about taking better care of yourself. So if you see their name on something, go check it out. If you know one of them, call them up, find out what it is that they're doing to help make a difference and make sure that you improve your health as well. Again, thank you, ladies, for coming and joining us today.
Okay.
And looking forward to celebrating 50 years in 19 or
Yeah.
19 in 2023. Right here with the Wichita Black Nurses Association at TKAAM Thursday, your midday cultural break.